Howdy, folks. Welcome to TwoX Labs. Any of you who have ever listened to my other show, Sex Talk with Erika Miley, will know this wonderful human. I get to bring back Dr. Laurie Mintz, author of Becoming Cliterate, a tired woman's guide to passionate sex. You know, we had the time change in the beginning of this week, so my words just don't work. I'm so glad you're here, Dr. Mintz. You have been an incredible, powerful advocate for cis women's pleasure and sexual empowerment. I really want to understand what led you to focus on your work on closing the pleasure gap and educating people about the clitoris.
Well, thank you for having me. It's always such a pleasure, and thanks for your complimentary words. To answer your question, it was my students at the University of Florida. I was a professor there for many years, and I taught the psychology of human sexuality to hundreds of students a year.
Mm-hmm.
And the first or second time I taught the class, I was shocked that the
I am
young women in
sure.
the class didn't know about their clitoris. They all thought they were supposed to orgasm from penetration. Like a whole body of knowledge that I knew when I was a young woman had been lost to this generation. And I was like, what
Yeah.
is happening? And what I realized is, well, my generation, I'm 65, we didn't have sex ed either, but we
Mm-hmm.
also didn't have false media images the way that these
Exactly.
young people do. I mean, we had some, but these young people have grown up with not just mainstream movies, but porn showing like women having fast and fabulous orgasms from penetration. So they didn't know about their clitoris. So many of them felt broken. So many of them were like, why
Yeah.
can't I orgasm from penetration? And it wasn't just a question. There was so much pain behind the question.
Yes.
And so I'll never forget one day I talked about the clitoris and I talked about how few women orgasm from penetration. And
Mm-hmm.
this is really like tells you the pain and the importance was there's like it's a 3 hour block. So 3 hours these students are sitting there from like 3 to 6 p.m. So of course you think as soon as 6 p.m. hits, they want to leave. Well, this particular day, when I talked about the clitoris and the
Yeah.
orgasm gap, 40 young women stayed for an hour after class.
I
Yeah.
am not shocked, but only because I have taught human sexuality for the university I teach at. I think you're just hitting on how desperately it, young women and women at really any ages want this information about their bodies.
Exactly. So that's when I started teaching to these young women and the young men who were like, why can't my girlfriend orgasm during intercourse?
Hmm.
And I would get notes from these students. Thanks to your class, I'm orgasmic. Thanks to your class, I now understand my girlfriend's orgasmic. And I thought, okay, this is not just these students at the University of Florida. Like, there is a need for this. And that's why I wrote Becoming Cliterate. But my
Yeah.
students were my inspiration.
And it is, I am sure, hour after hour after hour, you just had such fire built again and again and again to write your groundbreaking book, Becoming Cliterate. Since its release, do you think, and we're here in 2025, the awareness of cis women's pleasure has improved, or are we fighting the same battles?
Well, a little bit of both. So, I mean, I still honestly, I can't believe my book was considered groundbreaking when it came out because it was knowledge that I had known since the 50s. Well, I wasn't born in the 50s, since the
Mm-hmm.
70s, right?
Yeah.
When my own, coming of age. But the fact that it was labeled groundbreaking is because that knowledge was lost. So, and where are we today? Here's what I found, and a lot of what I know from teaching, because even after I retired from the university, I would go back and teach this class.
Mm.
And more women knew what the orgasm gap was. They'd heard of it in the popular press. More
Mhm.
women had heard about their clitoris, but they weren't making a connection between those things and their how to apply it in their own sex life. So it's like the theoretical knowledge was there, the
Hmm.
informational knowledge, but not the practical knowledge.
Yes, of how do you actually do something with the clitoris, or how do you tell your partner to do something with the clitoris?
Exactly.
Yeah, I mean, despite decades of research, we still see the massive pleasure gap between cis women and cis men. What are the biggest misconceptions about cis women's pleasure that are still prevalent today?
Yeah, and I really long for the day that my book is like, people read it and go, people didn't know that? Like that's
We
weird,
we hope for that day, right?
Right. Believe it or not, the biggest misconception is still around orgasms from penetration. The
Mm,
sort of sense that you can do it. And I honestly, I've heard even sex therapists say things like this. And that drives me up the
oh.
like, if the woman is aroused enough, if like making it this ideal, like that you should be able to orgasm in some way from a thrusting penis without accompanying clitoral stimulation, and that's the ideal. And in fact, the whole notion of like, it's like we're still being haunted by Freud, even the terms
Hmm.
vaginal orgasm, clitoral
Yep.
orgasm. As Betty Dodson said years ago, an orgasm is an orgasm is an orgasm. And it's about like maybe the point of stimulation is the clitoris, maybe it's the breasts,
Hmm.
maybe it's the vagina, not very often alone.
Hmm.
But it's still an orgasm. It's not a type of orgasm. And
Yes.
that is the biggest, misconception. Certainly, there is some evidence that we really got in the weeds about which nerves are involved from different points of stimulation. But we don't do this with men's orgasms. We don't say, we don't,
Correct.
did you have a blowjob orgasm or did you have an intercourse orgasm?
Was it a head of a penis orgasm or a shaft of a penis orgasm? And oh my goodness, don't even like if we even talked about a prostate orgasm, how much heteronormativity and all of the beliefs about what it means to have any kind of butt sex. So I can only imagine hearing this again and again points right back to that point you just made that yes, you might hear some knowledge from some of these students about the pleasure gap, but the practical application is still very, very much missing.
Yeah, absolutely. My students would do reflections after each class, and this one I read it and it was like, this summarizes it. They were supposed to write like, what did they learn and how did it apply to their own life, and it was all anonymous. And she said, today I learned about the orgasm gap in the clitoris. I'd heard those words before, but I never connected them to my own sex life.
Yeah.
And it's that connection. How do you take the knowledge of that most women need clitoral stimulation to experience orgasm, and how do you put that into practice during heterosexual sexual encounters?
Yes, absolutely. I think that there's a lot of ground to cover there on the why of that, and we're going to get into that. But I do want to I want to come back to this idea of the clitoris itself. It's only recently been fully mapped within the last 5 years, 7 years.
Helen, well, it's really interesting. There was a book, and I love sharing this knowledge, and a lot of people don't know this, but I know one of the authors. There was a book, I have it on my shelf here. I'd pull it out, A New View of a Woman's Body. It
Uh-huh.
predated Our Body Ourselves. It was from the
Mm.
Federation of Feminist Women's Health Collectives. And
Okay.
they couldn't map it because they didn't have they didn't have technology, but they talked about the internal clitoris.
Interesting.
And nobody really read that book. It's a fabulous book.
Okay.
But then it wasn't till Helen O'Connell, and I think it was in 2005, used
Mm.
MRI technology to map the full clitoris. Even though
Mm.
that technology had been around for, many, like years and been used on the penis before. Yes. Yeah.
Again, not a surprise.
Yeah.
I wonder because and then in 2005 that took place, and then how much time did it take for it to get to actual medical textbooks?
You know, I don't know if it's even fully integrated yet. I
I don't.
don't know that answer.
I
I mean,
don't think it is.
I don't think it is either. Because there's a woman on the internet, her name is escaping me right now, who was
Mhm.
like lobbying for that. And that was just
Yes,
a few years ago.
absolutely. And I know both of us have worked with medical professionals with our patients, but there are many, many medical professionals I have worked with who talk about that their medical school experience is lacking full anatomy and function of the clitoris. So how does that impact the way that we approach sexual health for cis women?
Yeah, well, it starts in like the sex talk in school, right? The
Yes.
boys learn about wet dreams, the girls learn about their periods. They learn about their internal organs.
Yes.
No, girls never learn about their clitoris in sex ed or health ed.
Mhm.
Doctors, it's like, I mean, I just came back from a medical conference. Now, this was ISWICH, so it was people who are International Society for the Study of Women's Sexual Health. So they
Mhm.
are focused on that, but a lot of them will say, like, this is they're learning this post medical school, that they didn't get clitoral anatomy, and that even during like when OBs are, do exams, like
Mhm.
very few, they go right in the vaginal canal. Very few even, like, here's my beautiful puppet, very few
We
even
love the
examine
puppet.
the clitoris. And,
Right.
you can have issues here. You can have
Yes.
clitoral adhesions here that make the hood stick to the glands, and that people aren't examining the full clitoris. And
Mhm.
there's an article that came out in the Journal of Sexual Medicine that looked at keywords, like how many studies there were looking at the penis versus the clitoris over a 20-year period in the Journal
Mm.
of Sexual Medicine,
Yeah.
and like 500 times more on the penis than the clitoris.
Of course.
Yeah.
Absolutely. I mean, here we are. This is why understanding the pleasure gap still matters. Let's talk, you have your puppets. Let's talk full through the full structure of the clitoris and understanding why it's essential for both individuals and professionals. I mean, you have your puppet. I have my sparkly girl. She's made out of clay though, so she's just for show. She's not as durable as the vulva puppet. So let's talk through the full structure of the
Yeah.
clitoris.
And maybe this would be helpful for the professionals. I will tell you, if this would be helpful, how I tell clients, exactly what I say to clients. Okay. And you're going to hear me compare this to the penis, not because I'm trying to elevate the penis, but because my clients know more about the penis than
Mm-hmm.
the clitoris. Okay. Well,
Yes.
this is how I explain it with my puppet. And
Hmm.
I just want to give a short shout out to Dory Lane, who makes these
Yes.
puppets. They're so beautiful.
Shout
And
out to Dory. You
yeah,
do incredible work.
yes, and all different colors. And
Yeah.
so anyway, what I say to a patient is, this is the outside area of your genitals. It's
Hmm.
called the vulva, and
Hmm.
it includes different parts. There are the what are called the outer lips, and they simply protect and encase what's inside, and they're
Hmm.
analogous to the testicles, the sac that protects the balls. And
Hmm.
then inside are called the inner lips, and they're chock full of touch sensitive nerve endings and erectile
Yes.
tissue, and they are analogous to the shaft of the penis. Now, please don't misunderstand by inner and outer. Those are their names, but it's very, very common to have one bigger than the other, and an inner sticking out of an outer. So don't,
And not completely perfect.
no, not even, not petite, very
Hmm.
asymmetrical. In fact, this is what gives vulvas their personality. They're like beautiful footprints,
That's right.
and beautiful snowflakes, I'm sorry, thumbprints. And if you follow the inner lips up, which they form the clitoral hood, which is analogous to the foreskin of the penis if it's not removed. And under the hood is the glands, and that, ouch, so sensitive, very few people can touch that directly. There's over 10,000 nerve endings in the glands of the clitoris, and it's analogous to the head of the penis. And there's also something called the mons pubis. And that is like where your hair is, or if you've removed it, it's where it would be. It's like a mound of fatty tissue. And a lot of women find pushing on that quite erotic. And the reason is because the internal clitoris runs right through here. And I'm going to talk more about that internal clitoris in a minute, but let me just finish. There is also your vaginal opening and your canal where penises and dildos can go in and babies can come out. But here's what's really important to know. All of the touch sensitive nerve endings that you need to experience pleasure and orgasm are on the outside of your vulva, your lips, your hood. And in fact, the opening of the vagina in the inner 2/3 has many pleasure sensitive nerve endings. When you get deep inside, there's, touch sensitive, there's pressure sensitive ones, which is why you can wear a tampon and not feel it. Because if you get it in right, there is no touch sensitive nerve endings there.
Exactly.
So let's talk about the internal clitoris. So this part is just what you see on the outside. And I'm going to go to a different model. There's the hood and the glands. Now her glands are sticking out from her hood, and that can happen for many. Those are also like the lips, different sizes. But that's just a piece of it. There's a huge internal structure. And basically, the legs of the clitoris run through this mons pubis, which is why some women like to squeeze or push. And in fact, there was a meme going, or a video on TikTok that went viral that says you can orgasm by pushing on your stomach. No, that's not your stomach. They were talking about the mons pubis. Also, many women like to pleasure themselves by putting their fingers inside here and pushing down. And the reason is that that's erotic is you're actually reaching through and stimulating the bulbs. Now, some women, they say if they do orgasm from penetration, it's because these bulbs are hugging and getting stimulated. Now, that doesn't mean we should tell our clients that they should try that, right?
Exactly.
But this is the full structure, and that's how I explain it to clients. But I'll be honest with clients, I don't usually bring this out because while it's super important for us scientists and educators and therapists to know about it, some people have used the internal clitoris to say, women should still orgasm from penetration because if the bulbs are big. And the research is still so clear that only 0 to 4% of women say their most reliable route to orgasm is penetration alone. The others want external alone or external coupled with penetration.
Yes. It would be so dependent on your anatomy being formed to a very specific size for penetration alone to be incredibly pleasurable or orgasmic.
Exactly.
So that idea, I think it's a good thought, like when you're thinking through how clients are going to see this, for us to be able to communicate. Yes, we understand the science. And when you're teaching somebody very clear instructions, try not to over explain and give options that truly would be incredibly rare physiologically.
Yeah. When I tell people if people say, but Dr. Laurie, I really want to orgasm during intercourse, I'll try really hard to sort of why do you want that? Break it down. Like that's
Mm-hmm.
not but if somebody insists, I say, well, then there's three ways that this can work. And one doesn't really work that good, but I'll tell you all of them. The woman on top position works because
Mm-hmm.
your clitoris is rubbing against a partner's pubic bone or penis, a body part. The other thing that works is take your own hands or a
Mm-hmm.
vibrator and stimulate yourself during intercourse. There's
Exactly.
also something called the CAT technique, the coital alignment technique, which has
Yes.
scientific evidence. And basically, what it is instead of going in and out, the penis is supposed to go up and down. And that
Mm-hmm.
way, it like the person, it thrusts on. Well, I tell you,
We need models to
it
show.
doesn't. It doesn't work that great because men are so accustomed to going in and out that it's
Yeah.
very hard to retrain to go up and down. I think the
Yeah.
one that works the best, take your own hand or a
Mm-hmm.
vibrator and use it. And that is no less sex. I tell clients that all the time. It
Yes.
is no less sex if you touch yourself during partner sex.
No less sex. And it does not mean that your partner's penis is inadequate.
Well, exactly. And your partner's penis is it. Okay, I'm going to say something controversial. Your
I'm
partner's
ready.
penis is inadequate to give you an orgasm because it's
Yes.
not stimulating the
Correct.
part that it's supposed to be stimulating, but it doesn't mean your partner is inadequate.
That's right. That's right. It's okay for us to adjust to what genitals can actually do.
Exactly.
So I think this is a great segue into how deeply societal and cultural expectations impact our patients and clients and students that we're teaching. So how do societal and cultural factors continue to reinforce this idea that cis women's pleasure is secondary or even unnecessary?
Yeah. I mean, certainly you don't have to look far, right? Any movie, you will see the woman. There's a few little exceptions with oral sex portrayed, but mostly it's a little warm up and then penis and vagina sex gets the woman an orgasm. And, so the media images, our language, this is the one that just, I cannot emphasize this enough. We use the word sex and intercourse as if they're one and the same.
Mm,
Even so, we're calling sex by the act through which most men, not women, orgasm, and we
mm-hmm.
use the word foreplay just to lead up to the main event. And if you think about it really carefully, if we overvalued women's pleasure the way we overvalue men's pleasure, we would call foreplay sex and
Mm,
intercourse postplay.
mm-hmm.
But I'm not suggesting we do that, but both should be equally sex. And
Yes.
similarly, in our culture, we call our entire genitals a vagina. And by
Mhm.
doing so, we linguistically erase what the part of ourselves that gives us the most pleasure. We're calling our genitals by the part that's more useful to men than to
Mhm.
women themselves sexually. So the whole culture is set up to devalue women's sexual pleasure
Mhm.
with the words, the images. And if that weren't enough,
Mm.
women are used to sell products. Our bodies are sexualized, they're objectified. By that,
Yes.
I mean they're turned into objects. Look at some ads that are pieces of women. Were
Yep.
and this idealized women's appearance and all that. And what it does for women is it turns themselves into objects that they look at. So a lot of women during sex are like, do I look okay? Versus,
Mhm.
do I feel okay? Then add to
Mhm.
that slut shaming and
Yep.
then throw in the mix like fear, because we know women are having more scary sex, more victims of sexual violence and coercion. You add
Yes.
all this together and what you get is a stew where women are cultural stew that really it sets women up to not have good sex. And then
Yes.
we wonder why women have less sexual desire. That's a whole nother topic. And there's lots
Yes.
to that. But one reason is because they're not getting good sex. Who wants to do something that's not good?
Absolutely. Or that you feel obligated to do.
Exactly.
So there's tons of these tendrils of societal and cultural factors. Sex education in the United States. This is where 2025 comes into the mix in where we are right now, where we are sitting, which feels like the longest 2 months of the beginning of a year in a very long time. And so sex education in every single state is so variable. We both know that it's not always required for it to be medically accurate. And so there are, I think, very much real world consequences to this. What do you think some of these consequences are by leaving out detailed information about the clitoris and pleasure from sexual education?
Well, I think, and I know I'm not the only one to say this, and I wish I remembered the author's name who wrote this, because it's just so important, I think, that by by leaving women's pleasure out of sex education, we are perpetuating and giving the idea that sex is something that men do to women versus something that we both enjoy. And that sets up just horrible consequences for young women and young men. And even do they I don't know if young people still use the baseball metaphor of sex. First base, second base. Remember that?
Yes, I remember it, but I don't know that I can't say that I have heard the college students that I teach use it. So I wonder if it's on its way out just because of
Yeah. Well,
familiarity.
yeah. So what Peggy Ornstein says is, in that metaphor, we're not even playing the game. We are the game on which we are the field on which the game is played. And so even if the
Yes.
metaphor is now not used, that notion has not
Yes.
changed.
We're not participating in the game at all. It
Right.
is
Right.
fully played on top of us.
Exactly.
So, what are some of the most common myths that about orgasms generally that you wish you could erase permanently if you had
Okay.
that magic eraser pen?
Okay, magic eraser pen. Women are supposed basic, right? Women should orgasm from penetration.
Mm-hmm.
Next one is that's a better that there's like an orgasm hierarchy. It's best with penetration. Second best if you combine clitoral stimulation and penetration. Third if it's just the clitoris alone.
Mm-hmm.
Other things I'd wish to erase is that you have to have an orgasm every time you have a sexual encounter. I mean, I write about the orgasm gap because if half the population is having fewer, we have a problem. But that doesn't mean that every sexual encounter, each person has to orgasm and that something's wrong if they don't. I would erase the notion that women's orgasms take too long or are too much work. I would erase the notion that sex for men, it should last a long time. The longer the thrusting, the more likely the better the sex, even though that the more likely a woman's going to orgasm. No, the longer the thrusting, the more she's going to get like bored and sore.
Correct. Correct.
So, um, what else would I erase? I'd erase that it's good to squirt. I'd erase that it's bad to squirt. Squirting is just something that happens to some women. If it happens to your body, great. If it doesn't, great. I would erase all shoulds. That any sentence that starts with the word should, I would erase that when it comes to pleasure and orgasms. So how's that for a start?
I love it. I love it. It would be a busy pen, but it would also be a better world after you erase those things.
Yes.
So I want to come directly to therapists and the role that therapy can play. So, how does internalized shame around pleasure show up in therapy, and how uh, can therapists help cis women unlearn it?
Big question. So many of us are raised to be ashamed of so much, our bodies, the way our
Yes.
bodies look, with not in some idealized way.
Hmm.
That we take too long, that the way we orgasm is weird if we need a certain kind of stimulation, that sex itself is kind of dirty or shameful. And some of those messages are given directly, and some are given indirectly, like just the
Hmm.
silence when something comes on, the TV, and your parents get all weird.
Yes.
So, I mean, I think that's like, it's hard to, whenever we talk about therapy, right? And there's like, a big question like that, how do you erase shame? Like, wow, there's not a technique,
Mm-hmm.
it's like, it's not a like, here's my shame eraser, poof,
Right.
it's really,
Here's the 5 steps to erase sexual shame.
yeah, but it's like telling people, like digging into that pain, telling them that
Hmm.
that doesn't serve them anymore, telling them that those messages were harmful and inaccurate,
Yes.
telling them more positive messages, asking them to
Hmm.
imagine what your life would be like if you had a different message,
Yes.
giving those message, sort of, if them like re-educating and re-parenting our clients so that they aren't ashamed anymore.
Yeah, absolutely. I think that we can play such a big role in the psychosexual education. We can play such a big role in the grounding of letting them feel those feelings in real time and process through the pain, the grief, the confronting the feelings about our bodies, and I think that we can. I mean, I don't know about you clinically, but I often am starting someone with non-sexual pleasure. uh, I'm often because I have worked with so many women that pleasure period is difficult to tolerate, that, and let alone sexual pleasure. So we start with non-sexual pleasure, and then we move to perhaps some body touching and some masturbation, and reframing what that could look like. But I think you're right. It all starts with processing the emotions and the acceptance of the reality of what's
Yeah.
true.
Yeah. Yeah. And I do think for many women, they think pleasure isn't for them. It's frivolous, I mean, and I think like I love that. Like, what little things can you get pleasure in? Cooking, eating, sniffing flowers,
Yes.
lighting a scented candle, like really getting a massage.
Yeah.
That's many steps down the line, but like,
Yeah.
teaching women to get pleasure out of senses, I think are good.
Hmm.
Music, dance, you
Yeah.
know, touch.
Absolutely. I I want to come back to the orgasm gap. Uh, why are cis women far less likely to orgasm in heterosexual encounters, and what needs to change? We've already been over a bunch of reasons why, but
Right. There's
fundamentally,
fundamentally, I'll answer it in two ways. One is they're not simple, they're not getting the clitoral stimulation they need. And two, they're up in their head worrying about if he's having fun and if they're doing it right.
yeah.
But let me flip the question, if I could, to why do women orgasm more with other women? And
Hmm.
and because what we'll learn, or what I'll say, has nothing to do with both having a clitoris. Like that's a myth. The reason is all science based. They communicate. First of all, they have more clitoral stimulation. They
Hmm.
take turns. They don't expect to both orgasm during intercourse.
Or at the same
They
time.
Right, exactly. There's more varied sex acts, so it's not all revolved around one. They take more time, and I already said they take turns, and they also have attitude, the attitude of orgasm centrality. that attitude that my orgasm is central to this experience. All those are science-based. None of those are about being a lesbian or having who you have sex with. Those are things that can be transferred into any sexual encounter. Taking turns, communication, taking time, having orgasm centrality, all of that can be transferred.
Absolutely. I think that the other science that I always think about when anytime I have read Becoming Cliterate is that most of the time when when a woman is masturbating, there is no time amount that is typically different than a penis masturbating.
Yeah, both usually take 4 minutes to reach
That is,
orgasm by yourself. Like, women know
exactly.
how to do this alone.
Yes, absolutely. I think something that might be important for us to talk about is what do you think the role of medical bias uh, plays in dismissing cis women's sexual health concerns, including issues with arousal and orgasm?
Oh, I mean, doctors are not trained in this, and so they are still subject to societal myths, right? So,
Yes.
I mean, telling women either that's just how it is, I've had many women, yeah, that's just how it is. Or like have a glass of wine and relax. Like it's all about anxiety or
Mhm.
being uptight. And sort of a dismissal and misunderstanding too of sexual pain. And that
Yes.
like sexual pain, as you know, there's two primary causes. One is having penetration before you're aroused enough or without using lubricant. And the other is medical issues. And
Hmm.
too many times and I can't say this enough for the therapists in the room. If your client tells you that they have pain and, it doesn't go away with lube and a lot of arousal prior to penetration, send them to a sexual medicine physician.
Yeah.
We know more and more about hidden causes of pain that only a few sexual medicine physicians treat. Something with the spinal cord, a vulva infection, so much. Like, do not treat sexual pain as a psychological issue. This drives me crazy.
Absolutely. Well, I am right there with you. It takes every single person I have ever worked with that has endometriosis, the number of doctors that they usually have to see is roughly 7 to 8 to
Mm.
get an appropriate diagnosis. And just the sheer lack of number of doctors who can treat it, it is astounding. And they are existing in so much pain, and then they're experiencing extreme pain when they're having any kind of penetrative sex. And we ignore it. And we say, oh, sometimes sex just hurts. Or there's this, as you said, assumption of that's just how it is.
Yeah, and women are being told this by their mothers. I have many young women clients whose mothers told them sex is just something you have to endure as part of marriage. Or how about the myth that it hurts the first time? First of all, it hurts because nobody is using lube.
Mm-hmm.
Nobody is using, I hate the word foreplay, but
Mm-hmm.
what I say instead is there's not enough arousal before penetration.
Mm-hmm.
And most of the bleeding is not from the hymen. The hymen has very few blood vessels. The
Mm-hmm.
bleeding is from the penis rubbing against the dry vaginal wall.
Yes. Yes. And the number of times when I've worked with my students and taught them about what the hymen is and how it is not this fresh seal of approval thing that bursts open the first time that you have any kind of sexual interaction, and that there are people who don't have hymens, and that there are people whose hymens have torn and also not bled. So I think uh, all of these pieces of education and breaking down serious myths and are incredibly important for the medical industry. So how can therapists in particular, and I would include healthcare providers in this, start integrating pleasure education into their clinical work, whether they're sex therapists or not?
Well, I think that whether you're a sex therapist or not, I'm guessing mostly sex therapists watch this, right?
Fair enough.
But I'm really, I think all therapists should be asking as part of a routine intake about
Yes.
sexual issues. And I just taught a class for a university before I got on,
Mhm.
and in trainees, and they were like, well, how do you bring it up? And it, just say, about 50% of people have some kind of sexual concern, and I'm going to ask you about this because those sexual concerns are related to other life concerns. Sexual
Yeah.
dissatisfaction is related to life dissatisfaction. It's related to relationship dissatisfaction. You can even say, I'm not asking you to be nosy. I'm asking you because it's really important for me to understand your whole life. And that's an important part of it. Are you having any sexual concerns? But
Absolutely.
with an explanation of why you're asking. And I think that's especially true if you're a male
Mhm.
therapist working with a woman or a woman therapist working with a man, to
Yes.
and we do that when we do like other things, like a client, I mean, I do regular general therapy, not as much anymore, but
Mhm.
if somebody would come to me with like a current something about their job upsetting them. In the
Mhm.
first session, I would be like, I really want us to focus on why you came here, but I want to get to know you more because, so many times what we experience in our adult life has some connection to childhood. So it may not seem related, your career distress, to your childhood, but I want to get to know you fully. So let me ask you about your childhood. See, we explain to clients why we do that. It's the same thing with explaining why are we asking you about sex during something when you're saying it's, you're coming in for something else.
You are beginning to model from the very moment you're meeting with somebody, and even before they meet with you and they're looking at that paperwork, that every conversation's on the table in therapy, including the sexual ones. I
Absolutely.
I say to my patients all the time, sex is the gasoline to every single other problem in your life. If we're going to talk about sex, I start to know those problems that are happening in the other parts of your life very quickly. And I say that to therapists too, so that they understand you will get down to what the problems are in somebody's life if you're asking about their sexual functioning early.
Yeah, it's so good, right? Because if they're like, I'm anxious about sex, right? Or I'm, I don't take time. Like, yeah, you're like, it is I think it was Esther Perel well, no, it wasn't her. Anyway, somebody said something very pithy, but since I can't remember who it is, I won't say it. Lots of
I,
people said pithy things, but
that's right. I think the role that therapists can play and healthcare providers can play is uh, when you are opening that door. The opening of that door is healing on its own,
yeah.
because then they'll start to get braver about telling you, and then maybe when they're ready they'll get braver about telling the people they love and the people that they want to be having sex
Right,
with.
right. I mean, Stephanie Bueller has a great book, What Every Mental Health Professional Needs to Know About Sex, and it's written for a general health professional. But I think it's such a good basic primer for sex therapists and just so
Yes.
full of wisdom. And she says you need to let your clients know that sex is spoken here.
Yes, absolutely. It is not a dirty word. So, what are some practical steps that therapists and providers can take to help clients who struggle with low pleasure awareness, difficulty orgasming, and maybe even sexual shame?
Oh, so let me do the difficulty orgasm because it's really much more straightforward if there isn't pleasure aversion and if there isn't sexual shame, right?
Yes.
So let's let's just set that aside for a minute. This is a woman who wants to orgasm, she just never has, and she's not averse to pleasure. She wants it. She's just not happening. It's pretty straightforward stuff, really. And there's a lot of scientific support. The first thing is, educating her like we just did.
Mm-hmm.
sending her home with a mirror to find her
Mm-hmm.
parts. And that's often very insightful if someone comes back and like talk about shame. I had one client, really strong, young feminist woman. She just hadn't had an orgasm. I didn't think this would. She came back from that exercise. She was like, it was disgusting. I almost vomited.
Mm.
So that told me, whoa. First, I thought maybe assault or something like that, but no, just a lot of body shame. So
Yeah.
every intervention is also an assessment. Like I want
Yes.
clinicians to know that if and I tell my clients that too. Like if I give you a homework and it really doesn't work, that doesn't mean the homework failed. It means we're going to learn something that we need to learn. Like
Mm-hmm.
that's like, so
I
don't just
hope all of the baby therapists out there are listening to what you just said, that every intervention is also an assessment, that you as a therapist didn't fail in trying this new homework out. It's giving you more information you didn't have before.
and them too, more information.
Absolutely.
I remember a couple, just to illustrate, I remember a couple who I started with sensate focus, which is
Mm.
this gradual, it's a gradual introducing a touch. And with them, I started really basic with the head caress, which you can find
Mm-hmm.
an example on Sex Smart Films. You just touch each other's face to get the idea of, what it feels like to touch and receive touch. They came back, they couldn't do it because and this
Mm.
was a couple that was like, we love each other, we just need help with sex. They couldn't touch each other's faces because they couldn't look each other in the eye because there was so much deep-seated anger. Now,
Ooh.
was I wrong to give them a head caress? No, not based on what they told me, but
No.
did that change the course of our therapy?
Heck yes.
Absolutely. Absolutely. You know, um, so anyway, back to the orgasm. So, what you have and that, and then let's work with the mind, right? Like what kind of sex, and this does get into shame. Like what kind of sex negative thoughts do you have? This is basic CBT, it's cognitive
Mm-hmm.
behavioral therapy. Uncovering sex negative thoughts like takes too long, sex is dirty, sex is embarrassing, and replacing it with positive thoughts, like. And
Mm-hmm.
then the other thing is being able to turn off the mind, and this is very difficult for many people,
Yes.
especially many women, that
Mm-hmm.
they're thinking during sex, am I gonna come, am I taking too long, do I smell good, do I look okay, is my stomach sticking out, like what's he thinking? And it is absolutely impossible to have pleasure when you're thinking. And so, really teaching clients, now, some people call it mindfulness, some people call it embodiment, like
Mm-hmm.
whatever you want to call it, what you're
Mm-hmm.
teaching clients is to let go of those thoughts and instead focus fully on sensation. And
Yes.
that can be learned outside of the bedroom first. I always use the exercise the next time you're brushing your teeth. Really focus on the sensations in your mouth, the
Mm-hmm.
taste, and when your mind wanders, and it will, bring it back to sensation. The next time you're washing your hands, the next time you're peeing or pooping,
Yes.
walking, anything that involves sensation, and learn to focus on it. And of course, if someone wants to take up a meditation or yoga practice, that's even better, but not everyone's going to
Mm-hmm.
do that. Although we do
Yes.
know that women who do yoga are more orgasmic. And I don't think it's the yoga. I think it's the body awareness that yoga teaches.
Absolutely.
Yeah,
And the body awareness, and there are those mindfulness parts of it that is
ex-
bringing your attention to the breath
that
and
exactly.
bringing your attention to your pelvic floor, bringing your attention to the different parts of your body that don't get attention
Your
all day
mula
long.
bandhas is what they're
Yes.
called. And
Abs-
the mula
I-
bandhas, yes. And
Absolutely.
so, helping women, learn that. And then masturbation, mindful masturbation, where they
Mm-hmm.
figure out what they like while focusing on sensations and really suggesting lube and vibrators and decreasing shame around vibrators. And then
Mm-hmm.
communication. Either the partner is already in therapy or you help them talk to the partner about what they want and communicate about that. And then you change the sexual scripts, that you help them do sex differently. No more foreplay just to get her ready for intercourse, game over. Taking turns. She comes first, which is a great book by Ian Kerner's title
Mm-hmm.
about oral sex. But it's not just that. It could be masturbation, and finger stimulation, vibrator, taking turns, or she
Mm-hmm.
comes second. Or if you want to come together during the same act, not at the same time, teaching them about self-stimulation during
Mm-hmm.
intercourse, couples vibrators, etc. Legitimizing that it's okay just for one person to be attended to and that not to
Yes.
be mutual. So that's sort of the basic bottom line of like sort of the empirically, scientifically supported steps. And I have a little rhyme that I
Mm.
have made up for clinicians to learn this. Um, educate.
Yes.
I'll go through them and then I'll come back. Educate, contemplate,
Okay.
meditate, vibrate, lubricate, masturbate, communicate. So
Mm-hmm.
educate, right, about the
Mm-hmm.
vulva, contemplate
Yes.
what attitudes are holding you back,
Mm-hmm.
meditate, that's the body,
Yes.
awareness, lubricate, vibrate, masturbate, communicate.
Love it. Love it. So, I hate to leave us on the harder parts of what's happening in our world today, but we're going to do it anyway. So, if we're looking to 2025 and beyond, what do you think some of the most urgent priorities are?
First of all, I just want to acknowledge the pain that so many people are in because of
Yes.
what's happening, both because their own groups of people of their own identity are being targeted and discriminated, or because people they love, or just because they're a human with compassion, and this is a painful, painful, scary time. And I think women, gay and lesbian individuals, trans individuals, women are going to suffer and are suffering. We're seeing our reproductive rights taken away.
Yes.
Is that going to change sex therapy? It already has for me. I have clients who don't want to, young women who don't want to have sex intercourse because they're afraid they're going to get pregnant. I have a pregnant client now who's terrified that she's going to like start to miscarry and then not be treated and die.
Yes.
I think we have to hold space for people's fear and pain. And I have said to clients,
Mm-hmm.
like, I don't, this is one, I've literally said, looked clients in the eye and said, this is one I don't have a technique for or a solution for.
Yep.
Like, this is not something, but we can talk about it. We can talk about the pain you're in. We can talk about how afraid you are. We can talk about how mad you are. But I
Yes.
think that it is going to affect a lot of our clients. And also for us as therapists, I don't know about
Yes.
you, but I mean, I have no problem holding space for my clients who are in pain. I've had to grapple with some clients who like what's going on, you
Yep.
know, and um and still maintain my care for them as human
Yeah.
beings. Um
Yeah.
and that's tough too. So we're in a really, really scary, tough time. So that's a hard place to end, but it's a truthful place to end.
It absolutely is, and I think I hear your care and concern, and I think as therapists we have to remember that holding this fear is going to impact our own sex lives too. Just the sheer amount of fear and pain and exhaustion that we are exposed to every single day. I have been telling my patients, but I've also been telling my fellow colleagues. I think it's time for ruthless self care. I think it has to be incredibly different in how we frame it. We can't. be exposed to a fire hose all the time and expect that we can find joy or sexual pleasure or be able to be present with our own partners at home after a day full of hearing clients pain like this. So it's shitty that we have to think about it and think through it in this way. And I think it's also, like you said, honest.
Yeah.
So you are an incredible value to our
Thank
field.
thank
And
you. So are you.
I appreciate you, and I appreciate everything that you're doing. I know that you're not teaching as much anymore because you're about to have a grandbaby. Is that correct?
I am about to have a grandchild. Yes.
That's so exciting.
It's very exciting. Yes, my first.
I'm so
It's
rooting for you.
yes, and my daughter is due July 29th, and she also lives 8 minutes from my house. So I'm cutting out many activities so that I can be involved. But I am still doing a lot. I'm writing another book.
Woohoo!
Yeah, I'm starting a podcast if I might have to pick your brain sometime, but thank you for your kind words and for having me on your very valuable show. Thank you.
We appreciate it, and I'm sure all the listeners appreciate it. Where can folks find you in the world?
My website is sort of the gateway to all of that, www.drlauriemintz.com. And from there, you can go to all of my social media. I'm most active on Instagram. Right now, my Facebook just got hacked, so I don't know if I'll have a Facebook it's just awful, but whatever. In my my website and Instagram are the biggest way to access me, and that both are drlauriemintz.com.
Fantastic. Everybody go buy Laurie's books and help pay for these grandbaby expenses. Wait, we have to know. Is there a grandma name yet, or is that to come?
No, I'm really struggling with that, honestly.
Okay.
Any suggestions?
I mean, I grew up in a unique time where not only was my mother's name Carol, but her mother-in-law, my grandmother's name was Carol. So there was already Grandma Carols when my children were born. And so my mom decided she wanted to be associated with something fun. So she's Grandma Cookie.
Grandma Cookie, that's nice. Cookie. How about just Cookie?
Oh, I kind of love that too.
Oh, Cookie.
Oh, and isn't that slang term for a vulva too?
I think it is. Yeah. Grandma Cookie. There we go.
Grandma
I
Cookie.
love that. Okay.
I am sure.
Yeah.
I'm sure my mom would be fine if you stole it.
All right. I'll just tell her thank you. Yeah.
I will. Absolutely. Thank you all again for listening to the show, and we will see you next time.
Thank you. Bye-bye.